So during these unprecedented times, it's not uncommon that kids will have questions about the coronavirus and COVID-19. We want to make sure that we're creating an open and supportive environment where children know that they can ask questions. But at the same time, it's best not to force children to talk about things unless they're really ready. Also important to know that the questions that we have as adults might be different than the questions that kids have as well. So asking that open-ended question, what do you want to know? What concerns do you have? Can be very helpful so that we're not overshooting our answers to questions that they don't even have. We also want to make sure that we're answering questions honestly. Children usually know or eventually find out if we're making things up, and this might affect their ability to trust us or our reassurance in the future. Also, be prepared to repeat yourself multiple times. Kids might need a lot of reassurance. They might ask questions over and over until they really understand the concepts. We also want to make sure that we're validating kids' feelings. This can be an anxiety-producing time. And to validate the fear can be helpful by providing some reassurance as well. Remember that kids seem to personalize these issues, so they'll likely be worried about their own health, the health of their parents and other caregivers, as well as friends and family. Also making sure that they don't have a lot of access to television. With the 24-hour news cycle, there's likely to be a lot of discussion and images that have come across the news and the television. We want to make sure that we're limiting exposure to this because it can be distressing. It's also important to know, too, that just because parents and caregivers might be wanting to know a lot about this, kids might not want to know anything about this. They really need to have their own downtime. They might just want to play catch, draw, listen to music, or do something else. We really want to make sure that we're incorporating this into their daily life, giving that opportunity to normalize everything that's going on, giving them an opportunity to play and connect with their parents and their caregivers is essential.